Everybody on Facebook, we appreciate your support. The show has been doing very well, and we've been hitting an international audience and countries all around the world. For those who are just joining us, please go to our link at voiceamerica.com. It's on the health and wellness channel. It's called Take Back Your Health. We have, I think, now 9 or 10 episodes. Go back and listen to the archives. They're all for free. We have wonderful guests, people like AJ Lanigan, the owner of the Beta Glucan, Zach Bush from Restore, a variety of indigenous healers, natural scientists, everybody you can imagine. We're going to be getting on the show. And in the future, we'll be bringing in athletes and some famous people. All right. So everybody, in 30 seconds, we'll be starting. Again, go to listen to our archives. Wonderful shows. If you haven't listened to it, it's free on iTunes. You can download, or you can get the Voice America app and download and listen to it on demand.
Welcome to Take Back Your Health. Your hosts are Dr. Sunil Pai and Maureen Sutton, who will explain the shocking truths about healthcare, prescription drugs, food and supplement industries. They will help guide you to take back your power and feel great again. Now, here's Dr. Sunil Pai and Maureen Sutton.
Welcome, everybody. Hi, today is a wonderful day. Today we're going to be talking about something that plagues everybody, almost everyone around this world today.
Especially this time of year, because it's spring and the wind's blowing and everything's blossoming.
We have allergies, right? And we're going to talk about different types of allergies, the allergies that you breathe, and also importantly, the allergies that you get from the foods that you eat. We're going to be talking about testing, the differences both in a progressive way and the old conventional ways. And we'll be talking about treatments from using natural things like homeopathics, herbs, Ayurvedic medicines, supplements, and some innovative acupuncture treatments and other items. So you don't want to go away. This is a very, very important show because we'll be talking the first half about inhalant allergies, environmental allergies, and testing and treatments. And the second half, we'll be talking about foods, testing, and treatments. But first, I want to give a shout out to my dad because it's his birthday. So happy birthday, Dad.
Happy birthday, Vital.
79 years. And I just want to tell everybody around the whole planet that he's the most amazing father. He's been an inspiration to me, how I became a physician. And he just retired last year, 53 years of service to our community here, practicing as an ENT, ear, nose, and throat, head and neck specialist, ear surgery, allergist, audiology, everything. And he's treated over 350,000 people, 4 generations or more in the state of New Mexico. So everybody out here in New Mexico is giving also a shout out to my dad. Happy, wonderful 79th birthday. I wish we were there to celebrate, but hopefully we can be there with spirit and catch up with you soon.
Everywhere we go, it doesn't matter where we are in the world. Someone says, Dr. Pai treated me or treated my child or treated my grandchild. Everywhere we go, everyone knows who Dr. Pai is.
Even in remote places when we travel on vacation, they're like, is your dad? I'm like, yes, my dad is. So thank you, Dad, for a wonderful, I hope you have a wonderful day with the rest of the family. So today, as my dad's an ENT, what a perfect topic to talk about as well is allergies. And we all are plagued with allergies. And so first today, in the first half segment of the show, we want to talk about environmental allergies, right? We call them seasonal allergies, or some people, more specifically, we will call it inhalant. These are the things that you breathe, you inhale, right? And these are things that are in the environment, such as grasses, right? Timothy grass, Bermuda grass, Johnson grass. We call them the Manny Moe and Jack of grasses. We also have weeds.
Pigweed, ragweed, tumbleweeds. Wow, tumbleweeds are all over the place right now.
Yes, we call them Jumanjis because they roll like the rhinos in the movie. They just roll through town on the windy days. So we call them the Jumanjis. We also have trees here like juniper, cottonwoods, maple, sycamore, oak, pine, you name it.
All these beautiful flowering trees that are blooming right now, the bright pinks and whites.
The mulberries and chamisas and all that stuff that just continues to blossom and bloom. And we also have things like dust mites that people will talk about, a little bit of dust mites, and importantly, dogs and cats. Right? Many of us have wonderful pets. Pets actually increase your lifespan through all the data, and they're wonderful, give unconditional love, but huge allergies for many people. So these are the
don't forget molds.
And molds. Oh yeah,
Yeah.
we'll talk about molds because molds is common not only just in the Northeast and the Northwest and in the South, but it's also in the Southwest. In very dry, arid climates, we have a lot of molds. So grasses, weeds, trees, molds, dust mites, cats, dogs, and roach dust is another thing that people are very allergic to. Now, what are the symptoms, Maureen, that people can get from allergies?
Itchy, watery eyes, runny nose, coughs, asthma, sore throats, even pain in the chest.
Postnasal drip, wheezing, red eyes. Remember, anything that's an itis, if you go back and listen to our earlier episodes talking about an inflammation nation, everything that has an itis, red eyes, conjunctivitis, runny nose, rhinitis, sinus issues, sinusitis, bronchitis, all these things are inflammation of the upper respiratory tract. This is all due to inhalant or environmental allergies. Right? So these are the things that plague most people around the world. And we have to look at, well, what do we do? How do we assess? Aside of knowing that I touch a dog and I might get sniffly, or I run outside, or we're mowing the lawn and we're pulling weeds and we get all these upper respiratory symptoms, how do we actually know that we have allergies?
And specifically which allergies they are.
Specifically, that's key, because we want to be very specific when we give treatments. And the way that's most people in their lifetime have been tested is through skin prick testing, right? That's when they go to the allergist, conventional allergist, and they prick the skin, with a little needle and a little bit of the antigen. Antigen is the allergen, the protein of the allergen that you're allergic to. So they'll put a little bit of a ragweed and a juniper and a little bit of a dog and a cat, and they scratch the skin just right underneath the surface. And it's not very pleasant.
Yeah, sounds like torture to me, and nothing I would want to do.
And it can be torture, because what happens is now, since this allergy treatments have become a big boom, there's a lot of franchises in conventional medicine that sell to allergy practices. They do the advertising and people come in, is that every time they prick the skin, they get to bill for that prick. And so now we have patients coming in with 50, 100, up to 200 pricks on their arms and all over their back. Especially the little children, they don't like that. And as a kid, I didn't like it myself. It's very uncomfortable, because the problem is then after they prick you, you go home, you come back in about 48 hours, and then we look at your arms and your back, and we're supposed to see a little bit of an allergic wheal. This is a histamine reaction to show how much you may be allergic to that ingredient that has been pricked into the body.
And then how often do you need to be treated with this therapy?
Well, the conventional therapy that they give after they do these the skin prick is they measure these wheals, and based on those size of those wheals, which we'll talk about can be a difficulty aspect of actually getting specific on that, but then they dose allergy shots, which is called subcutaneous immunotherapy, SCIT for short, subcutaneous immunotherapy. And these are shots that are given weekly. Right? So everybody goes, oh, I have to do allergy shots. Or most people who are older, they'll say, oh, yeah, when I was a kid, I had allergy shots. I had to go weekly. Again, usually it's about 4 to 5 years for allergy shots. And there's a couple of problems with the conventional way of doing that. First and foremost, there's something called inter-reader variability. And what this means is that every time we prick the skin, we now know that this wheal that raises on the skin, it's an inflammatory reaction, and it's due to histamines. So the inflammation comes through the blood, right? And it will trigger this histamine. Histamines are in a cell called a mast cell. It explodes, and that creates a little hive. That creates all the mucus, and that's why we give anti-histamines, for example.
And what are they pricking you with? Like a little needle?
A tiny little needle, with a subdermal needle with the allergen, just a little bit, a small amount. They actually raise a little wheal, and then we'll measure whether the wheal goes down or whether the wheal will swell. Okay. The problem is with people who are very allergic is that they will light up like a Christmas tree. I mean, they will have hives all up and down their arm or their back. And what happens is they can bleed into each other, meaning that the hives become so big. Sometimes, like when you get multiple mosquito bites, it looks like you got one big mosquito bite.
Ooh.
Right? And so the problem is that when they read it, it's not very specific. They will look at it and they'll say, okay, they'll measure it with the little tool visually, and they'll say, is it a 1 or 2 or 3 or 4 kind of thing. The bigger the number, the larger the allergy, or the more sensitive the person. The problem is the studies will show that even with the same responder, they have different reading of that. So someone Monday morning will read a number slightly different than Friday at 5 o'clock, even the same office, same people. So based on that, they dose these antigens or the amounts of the allergen shots, and then they give it weekly. The problem is is that it's not very sensitive because there's a plus or minus. If there's differences in reading, then what we're putting in there, those doses aren't as accurate as we would want them to be.
All right. So you're saying that the skin prick testing and this form of allergy treatment is not very accurate.
Well,
and you go through a lot of torture for something that's not going to be totally accurate.
yeah, for most people who deliver it, they won't call it torture, but for most people who get it done to themselves, they might describe it that way. And the thing is, because usually most people get all these skin pricks, and then they go back to the doctor and they prescribe an antihistamine, a nasal steroid, an oral medication or some kind, and that's what they came into the office already taking.
And how long do you have to have the injections for? You get them weekly, or
so most people get it weekly, but it takes usually about 4 to 5 years. And the problem is the compliance goes down. About 80% of the people will stop taking allergy shots within the year due to inconvenience. So what the conventional system has done is take these therapies of these shots, and now they do it like once a month. Now there's some companies and protocols that are doing it once every 3 months. The problem is that the risk of having side effects is higher because we're now just cramming, a month or a week or now 3 months of the stuff that you're allergic to into the bloodstream. Now, the risk of allergy shots is that you can get anaphylaxis. That means you can actually have a life-threatening reaction like trouble breathing and stuff. And that's why when you go to the doctor's office, you have to wait 15 minutes before you leave. That's the inconvenient part as well, right? So 15 minutes once a week, every week, 52 times a year for about 4 to 5 years. Now, there's another type of therapy that's unique. It's called sublingual immunotherapy. It's allergy drops. And if you go to allergydropstherapy.com, you can learn a little bit more about it. But in essence, is that we do a blood test. In our clinic, we've been doing a blood test. Why? Because I don't have to worry about interactions between homeopathics that you took, your blood pressure medicines, your thyroid medicines, sleeping medicines, anything that, anti-inflammatories, for example, vitamin C can affect the histamine reaction. So doing a blood test, we get very specific what number on which food or which inhalant, which cat, dog, dust mite, tree, weed, each species, how sensitive, and it's done in the blood. So in the machine, it will run and it's measuring its immune response. Based on that, we then give sublingual drops on a protocol where each antigen is then dosed specifically from a computer reading, which is very accurate. And then that person takes a sublingual drop underneath their tongue 3 times a day for about anywhere from 2 to 3 years. And it looks like this. It's like a little meter dose pump underneath the tongue. They squirt it 3 times a day.
Underneath the tongue? Mm-hmm.
Yeah, underneath the tongue. And then they squirt it underneath the tongue, and they hold it there for about a minute or 2, and then they swallow it.
What's in the pump?
So what's in the pump is the allergens, the actually antigens. So it's not a homeopathic. It's actually the same thing that we use as shots, just on a different protocol. And it's stored in vegetable glycerin. So there's no refrigeration. It doesn't matter if it gets hot or cold. And so people can take it and travel with them. So it's a great way to
no weird additives or anything that's going to cause more problems or toxicity.
No. So this is a great way to look at when people want to look at, hey, I've done shots and I want something more specific. We recommend blood testing. And also we recommend something called sublingual immunotherapy. If you go to allergydropstherapy.com, you can learn more about this. There's 100 studies showing now that the allergy drops is more sensitive and specific in terms of efficacy. So people actually have better results taking it daily versus taking it weekly or taking it monthly or taking it every 3 months.
And kids can do this as well. How old do they start?
Kids can be very young. As soon as they can start putting this at the age of 2, we can start doing the allergy drops in children as long as parents can squirt this under their mouth. And the best thing about it is that, children's usually about 2 years and then they're done. Right? So after we come back from our commercial break, we're going to talk about more treatments now. So now for some people want to do drops, we're going to talk about natural therapies, and eventually we'll get into foods. So we'll be back after a short break from our sponsors.
All right, you're clear.
All right, everybody on Facebook Live, we hope that you are enjoying this section. We've been talking about allergy treatment and, more importantly, some of the conventional aspects of looking at allergy shots versus allergy drops. And we have found, and what the data has found, is allergy drops do way better clinically and convenience-wise and safety. And remind me when the show starts, I will talk a little bit about the safety issue about that as well.
Okay, that'll be very important. And I'm sure everybody's having some problems right now with winds blowing and everything is blooming and blossoming. I know I am. So, and I was treated a couple years ago for juniper, and I've had no problems with that at all. So there's something new that's blooming that I was not allergic to before, and now I'm suddenly allergic to it. I think the longer I stay in New Mexico, the more allergens I get.
Right. And so one of the things that we'll talk about is novel and new ways to treat the allergies that are not just allergy drops. Now, allergy drops are great because people who come to see us, we can get them the testing, and then these drops can be sent to them every 6 weeks. And again, in children, as little as 2 years, in adults, anywhere from 2 to 4 years, depending on how healthy we get the rest of the body, which we will also discuss because we can enhance, if we get the body stronger, any therapy that you give that's immunotherapy will work better.
And do they have a taste when you put them under your tongue?
No, it's actually a little sweet taste because it's a little vegetable glycerin, but there's not a specific flavor or taste to it.
Okay.
Okay.
So that makes it really easy for little kids to take it.
Kids is great because what happens is for all the parents out there, if you have a very allergic kid, the best thing to do is if you treat them early, then by the time they get to middle school or middle school to high school or high school before they get to college, then they're not doing, they do a lot better in school. The focus, the concentration, a lot of people have just bad allergy. They don't sleep and then they don't study well. And so one of the simple things, we look at allergies being a nuisance disease, just as a quality of life goes down. Simple things like that improve a child's focus, attention, sleep, behavior. So even when kids have ADHD or autism spectrum or anything, if you address allergies, that improves just overall symptoms of how they behave, how they interact. Because remember, it makes all of us miserable on some level. So the key is to make your body stronger. All right, so we're going to be joining here soon back on the radio program. Again, thank you all for listening worldwide. Go back and listen to the archives. Go to sanjevani.net.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Welcome, everybody. We're back. We're talking about allergies. Oh, my God. This is a bad allergy season here in New Mexico and also worldwide. Anytime there's wind and things that are blooming, it's spring now, most of the places in the United States, then we can say that allergy season is here. We were just finishing talking about sublingual immunotherapy called Allergy Drops Therapy, allergydropstherapy.com to learn more about it. But it's a safe, effective way. It's only prescribed by doctors. It is a prescription. It has to be done specifically by blood testing, which is better than skin prick testing, and it's safer. Remember, when people give shots, every time we give a shot, there's a 5% risk of anaphylaxis. That's why you have to wait in the doctor's office for 15 minutes to make sure you don't have a problem. But that 5% risk is there throughout the therapy. So whether it's 1 year or 5 years into the therapy, 5% every time you get it. Some of these larger therapies where they're doing every month or every 3 months, that risk can get a little bit higher. Okay. And so the nice thing is with the allergy drops therapy for 60 years worldwide, not a recorded incidence of anaphylaxis. When you dose these drops sublingually underneath the tongue, sublingual means under the tongue, small doses of what you're allergic to, you're able to improve your immune system more effectively. So there's 100 studies that will show that the allergy drops therapy is more effective than the allergy shots because training your body daily is better than treating it weekly or monthly or every 3 months, just like going to school.
So this would be really wonderful for kids who are outside playing in the grass, doing soccer and football and baseball and all those sports. So that would be really excellent for them to be training their body so that they're not having allergic reaction all the time.
Absolutely. And what we like to do, the sooner the better. And we want kids to be more physically active. We want kids to play soccer and football and tennis and track and, volleyball and swim and all these other things. But the allergies can inhibit how they perform. So again, sublingual immunotherapy, we call it allergy drops therapy. Now, moving on to other therapies now, we do have natural therapies, homeopathics. Now, a lot of people love homeopathics. We love them because they're safe. right? There's a little bit of an issue with the FDA now kind of going after homeopathics. We won't talk about that on this show, but the idea is that they're safe and effective. There's a lot of brands out there, and there's some of them that are over the counter and some that we offer. And a few of them that, some of them come from Italy. One's called Guna Allergy Prev. It's drops, 20 drops twice a day. This works great for allergies. For those people who want to put something into a liquid or beverage and drink it twice a day, Allergy Prev. And there's also brands. There used to be a company called Heal. It's no longer named Heal, but they now call it Clear Life. And it's a tablet, sublingual tablet. Well, nice thing about these kind of tablets is that they work pretty fast. You can take it sublingually. Even your pet can take it.
Yeah,
And
we give it to our dog.
yeah, and her allergies are so much better, especially when she rolls in the grass and plays in the weeds and stuff right now that's blooming in her backyard. So the nice thing about homeopathics, they're completely safe. And again, you can multiple dose it, so you can take it 3 or 4 or 5 times a day. Again, no side effects. And so again, things like tablets are great. And then when we get to nasal issues, most people use steroid nasal sprays. They have side effects over a long period of time. They also can cause early cataracts. So people who use a lot of the nasal steroids like Flonase, that's over-the-counter, Nasacort, and fluticasone type drugs, they can get early cataracts, which is reversible if they stop. This has only been seen predominantly by ENTs because they see hundreds and hundreds of people a week, and they've been able to track this. Primary doctors, we haven't seen that because we only see one person here or there. So when we move to natural therapies, there's a couple of homeopathic natural therapies that work very fast.
So we have Reboost, decongestion.
So Reboost is by the same company, and the nice thing is it works pretty fast, okay? And when you use a nasal spray, what you want to make sure is that you stick the nozzle in towards the nose, and then you want to turn it out towards the ears. This is a special trick that my dad has taught, all the ENT residents, all the medical students and all, is as if you follow the anatomy, go into the nose and then turn it out towards the ear, and then you spray it, you get more of the spray into the sinus cavity, and then whatever medication or homeopathic or natural medicine that you use works better. Again, Maureen showed them, it's called Reboost.
Oops. Here you go. This is for decongestion. And then there's another one also
called Clear Life.
Cool. Yeah, and this it's very safe. I really like homeopathics. I use them myself.
So the nice thing is that there's no rebound and there's no addiction. The problem with the synephrine products, Afrin type drugs that they're out there, that you spray it, it opens up very quickly, lasts about 6 hours, increases heart rate, increases blood pressure, can actually cause problems with some people that have glaucoma issues, right? And other medications. What happens is that they cause a rebound effect. So if they use it actually for like 48 hours, they keep using it, then they get stuck on it. So people become addicted. They can't get off their nasal sprays because once they stop, there's a rebound and their nose gets more and more congested.
Also, it dries up all the tissues inside your nose and actually causes more inflammation because of that. Then your nose needs to run in order to lubricate the tissues.
That's that rebound effect. So boom, all of a sudden, after like someone's using a 12-hour nasal spray, they use it for 2 days. On the third day, they get, they stop using it. They get extreme congestion, and then they're stuck on it. So then there's some natural therapies that we recommend.
Here's another one, Sinu Arega, and I like to use this too. It's pretty powerful, but this is more for infection. Is that correct?
Yeah, it has a little bit more of an antimicrobial effect. So those people who are more prone to have sinus infections and they have a lot of nasal congestion and mucus, they can use it. It's very powerful. So I'll tell you, when you put all the different herbs in there, you'll notice a boom. It's going to have a little bit of a hit to the sinus cavity, and it'll clear up. It takes about a minute or two. It's a little slower than a drug, but a lot safer and more effective.
And you can feel that going into your ears and down your throat. So you know that it's protecting all of those tissues of the sinuses into the ears and down the throat. And then my very favorite is nausea oil, which actually lubricates the sinuses. So there's some special oils that are in there. This is an Ayurvedic product. So maybe after cleaning out your nose, you'd want to put the nausea oil in to protect the tissues.
Absolutely. So what the nausea does is the Ayurvedic oils are usually organic sesame plus a couple of Ayurvedic herbs that help for allergy. It provides like a barrier. So when you put it, you put a few drops into each nose and you sniff it all the way till you almost reach the back of the throat. Okay, I lean back in my chair off the head of the bed so I can do it. Otherwise, I'll spill it all over myself. And the nice thing is it prevents the pollens and the dust and everything from sticking into the sinus cavity. And it really provides a lot of moisture. A lot of people have forced air in their house or these kind of heating and cooling units that it dries out their sinuses. Wonderful, wonderful treatment. And then there's other treatments that we look
Oh,
at.
I just want to say something
Sure.
about after you use the nausea oil. If you find that it's going down your throat and you don't like the flavor of it, it's really good to do a saltwater gargle afterwards. This is
Right.
very good for your throat.
And the nausea drops are great because we always recommend people to do a neti pot. Neti pot is a nasal wash. And you always want to make sure that when you use a nasal wash, and you can get different kinds, they're on the market. We have them at our office here. And you can see some of them are called SLIT, right? And you want to make sure that the nostril container itself is lead-free. After Oprah said a couple of years ago, oh, I love to use neti pot, and then all these companies were making it from China, had lead in there. So make sure that they're either BPA-free plastic or some kind of porcelain that says lead-free. We like the neti pot because they're using gravity. You're not using the force of a water pick. The slower the flow with gravity, the safer it is, the easier it is to take things out. And
Blasting out your sinuses.
it also comes with these kind of rinse packets, which will have xylitol. Xylitol is a natural sweet additive or sweet derivative. I don't recommend it as a sweetener, but you'll see xylitol in these packets that we recommend, or you can just use a little xylitol just as a sweetener itself. Put it in your neti pot. Xylitol also prevents the mucus. It makes it really slippery, so it prevents things from sticking. Okay.
Oh, nice.
So you'll see xylitol like in toothpastes and mouthwashes, a wonderful thing to use. Again, doesn't cause any kind of addiction or danger.
And xylitol is totally safe, correct?
Totally safe, but I don't recommend people taking it as a sweetener. Too much xylitol, when you see like in gums and stuff, actually can cause diarrhea. That's the side effect. So there's no nutritive value, but it helps with the mucous membranes, nasal washes, mouth washes.
So it won't cause any kind of diarrhea or anything if you're using it in your sinuses. It's when you're ingesting it orally.
Yeah, and that's in large amounts. So but you'll see that people have these sugar-free gums. They take too much of it. They'll say don't take more than like four chews a day. Otherwise, you can have loose bowel movement. So anyways, it'll teach you not to eat too much gum or chew too much gum.
I wanted to talk about the homeopathic eye drops
Sure,
too.
eye drops. Yes, go ahead real quick.
We have something called a natural ophthalmics RX, and these are only available in doctors' offices. This one's a homeopathic allergy desensitization. I can't say that word today. And these are wonderful. I use these myself almost daily right now just to keep my eyes from drying out and also to help with all the allergens that are blowing into the eyes.
Yeah, I like this company because it's basically for physicians and it's a specific homeopathic ophthalmology company. There is other ones on the brown over-the-counter, Simla-San, that's for red eyes. All good, but this works just a little bit more clinically better, in my opinion. And from our patients, they seem to like it a little bit better. They have to use it less often. The benefit is that you want to avoid the Visine type of eye drops that, again, cause that constriction because there's a rebound. So when people start using Visine with red eyes, they use it, it clears up the eyes, and then they stop using it, and boom, the eyes flood up again. It's the same thing with the nasal spray. You use it, it can cause the constriction, and then if you stop using it, there's a little bit of an explosion, and then people get stuck using that.
And this particular company also produces eye drops for menopausal women whose eyes get dry, and so it helps to produce tears. So I highly recommend that as well.
Yeah, and they also have things for cataracts, and also so that helps with cataracts and floaters. So wonderful thing. So when we come back, now we're going to get into the other aspect, a little bit of lung issues, and we'll talk about what you can use for lung treatments for asthma, and then we're going to get into our favorite aspect, foods, right? Because food is medicine, and we'll talk about that when we come back after this short break.
Clear.
All right, everybody. Thank you for watching here on Facebook Live. We just finished talking about some seasonal allergy aspects, environmental allergies. We talked about allergy shots on allergydropstherapy.com. You can go there and learn a little bit more, or go to sanjevani.net, SANJEVANI.net to learn more about that amazing treatment, how that's actually better and easier, safer, and more effective and more cost-effective than using allergy shots. And we will then we talked about homeopathics, So wonderful to use things like homeopathics, like tablets. We have tablets that are available, and also drops, neti pots, right? This is all traditional Ayurvedic medicine now kind of modernized with packages and things that are easy to use. And
Nausea drops.
the nasi oil, we love it.
Yep.
I can't say enough for a nasi oil because it just lubrication of the sinuses can just help a lot of people just desensitize, especially when it's really windy. These are things that if you do before you go out to mow the lawn or clean the house, you have less symptoms once you do so.
Great. And there'll be some more information about some Ayurvedic treatments, especially for the lungs, which we're going to talk about, for asthma and bronchitis. A lot of people have chronic bronchitis, so we have some wonderful, wonderful, very simple treatments for that are actually luxurious treatments.
Right, and we offer them here. That's one of our specialties here at Sanjevani. We do a lot of panchakarma, and we had a special archive. It's one of the archive shows, which we talked a little bit about panchakarma, a little bit of Ayurveda. So if you missed one of those episodes, go back and listen to the one with Dr. Bharat Vaidya. And you also can go back and listen to the one about Shilajit and learn a little bit about pure black, the live resin. That is also very traditional in Ayurvedic medicine that can also help with inflammation and cell response.
The glucan.
And the glucan, which we'll talk about in a minute.
Your immune system is very important, keeping it up to help with your reactions.
So everybody on Facebook Live, we also have a food as medicine retreat coming up. So if you go to sanjevani.net, you can go down and you can join me, Maureen, Robert Scott Bell, a wonderful team of people out in Curacao, August 5th through 11th.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
All right, everybody. Today we're talking about allergies. We just finished talking about, eyes and sinus issues, and now we're going back into the lungs. A lot of people have asthma, wheezing. They need to take inhalers. Some of them are fast-acting. Some of them are steroids. Again, long-term issues with the steroid inhalers. I have no problem with the short-acting ones, but we really want to get the body stronger and more tolerant to these types of allergies, and that's why using allergy drops therapy or using some kind of immunotherapy is good at helping the body so that you're not taking all these products just for symptomatic or treatment. These products that we talked about are safe and effective, but again, our core is to get at the base of why you have the allergy, test it, and then treat your immune system. So we're talking about lungs, and when people get allergies, there's some cool natural therapies for lung. One of them is a salt inhaler, and it's called a TheraPipe, and you can just get it online. We used to carry it a lot of times here in our office, and it's from these salt caves that come from Turkey. Greece, Turkey, a lot of places in Europe. They have these trips where people would go in a bus and a van, and they'll go and sit in these salt caves, and the ionization of the air around that particular salt composition actually has an antihistaminic effect. Okay, it also has antiviral effect and some other benefits. But what happens, so people would go, and there's a lot of places now in India where actually one of my uncles has recreated a cave in the middle of a city where people can go and pay very, very little, and kids can play in the sandbox, people can do their internet, and as they sit there, they're breathing the salt ionic air, and that actually helps clear the lungs. It's not a fast-acting thing, but it prevents the onset, and it lowers the frequency and the intensity of asthma very effectively and inexpensively.
There's a few places here in the U.S. that do that as well.
Yeah, there's some spas and stuff like that. Now, when people actually get a respiratory infection, then there's some aspects that we can look at. We can have one where we use a hydrosol of a silver, and you can go on our website and look at the silver product that we have. And we actually have a air nebulizer. It's about $30, and people will air nebulize. You can't heat the silver product. You just nebulize it 3 to 4 times a day, and most people can get rid of their infection, which is nice because
it's a very small little nebulizer. You could fit it in a handbag and travel with it easily. It's not like a big thing that you have to put on your face, and it's very small. It's portable.
And we just had a guy last year who had They came to my office for some other medical primary issues. He had a port on him, and I'm like, did he have cancer? I was kind of confused why he was seeing me. And he's like, oh, no, I'm coming to see you from other issues. I go, what's the port for? And the port is he had a sinus infection that was continuing for 2 years. And he had already 3 sinus surgeries, and infectious disease was treating his sinus infections with a port of antibiotics, which we were not privy because it's flown in from the CDC in Atlanta to treat him, but it was still not going away. After 2 years, IV antibiotics, really, really specialized antibiotics, 3 surgeries, and we just did this air nebulizer of this hydrosol of silver, and within 3 days,
Wow.
kid you not, 3 days, gone.
Yeah, he was delighted. I remember that guy.
And
yeah.
he was so surprised. He's like, I really didn't believe this was going to work, Dr. Pye. I'm like, well, this is why we're always integrating. We're looking at deliveries of new things. Also, when people have sinus infections, one of the things that we have become very famous for is it's called Dr. Pye's famous nasal wash. And that's actually a prescription by compounding pharmacy. Physicians out there can always contact our office to learn about it. But what we do is that we prescribe a certain antibiotic, an antifungal, a little bit of a steroid, a little bit of xylitol in a nasal wash, and they use it in their neti pot. We never want to treat, always want to avoid as much as possible using antibiotics, which is a local infection, treating it with an oral antibiotic, which is systemic, knocks out your microbiome and everything else in your immune system, right? We talked about the gut microbiome in our previous archived episode, so go back and listen.
Just use that so that it's only going into the sinuses, and it's local then. It's not going into the gut and knocking it out.
Yeah, I don't need to treat your toe if you have a sinus infection. I don't need to treat the rest of your body systemically when there's still local infection. So it's integrative medicine is always looking at how we use the best of conventional therapies. But, if you were in Europe, compounding pharmacies use nasal washes all the time. But here, it's always about prescriptions and dispensing, and we miss that actually targeted effect.
Oh, we wanted to talk about Histoplus too. That's a supplement.
Oh, yeah. So one of my favorite, those people who don't want to do nasal sprays, don't want to do homeopathics, and they want something that they can take in the morning and the evening that works really well, we have a product called Histoplus. And this is a blend of 2 important ingredients, the beta-glucan, which we always talk about, and also importantly, quercetin. And if you give the right potency and the right dose of quercetin in Histoplus, it actually works better than a Zyrtec, a Claritin, or an Allegra without the side effects. Okay, so this is a great product. Lasts about 12 hours. So I usually take it once if I'm mowing my lawn or we're cleaning the house. And so some people want to say, I want to take this, but it also has other benefits. It has some anti-cancer benefits, anti-inflammatories. It has a lot of side benefits. It's a flavonoid, a lot of research on quercetin, but we mix it with another ingredient to have a little bit better immune effect. So Histoplus, everybody who's out there want to learn something, say, I'm tired of my antihistamines. I want something natural that has other benefits. Histoplus would be a great thing for you. Now, what we want to talk about now is foods, because foods is the big issue.
Wait. We forgot something important.
Sweetener?
An Ayurvedic treatment called Sweetener.
Oh, this is amazing.
It's a really wonderful treatment. So when I give a Sweetener, I usually give a full body massage and, make sure that I'm using these beautiful herbalized oils into the head and massaging the sinuses and moving the lymph. And then I put this tent over the top of the massage table, and the tent has a vent that actually fits over the top of a crock pot. And in the crock pot, there are all kinds of herbs. And sometimes I put essential oils in there. And they're boiling, and the steam goes up into the vent and then steams the entire body. The head is out, so you're not heating the head. That's very important in Ayurveda. And I keep a cool ice pack over the heart so that we're not overheating the heart. And the people who use this with chronic bronchitis always say that it's better than a nebulizer treatment. And I always have Dr. Pye check them before and after, and we get amazing results from it, right?
Yeah, we actually can listen, with stethoscope. We can hear some wheezing, some tightness in the chest, and then post-Sweetener treatment is just like we gave a medicated nebulizer treatment with medicines. The nice thing is There's no side effects, and it's a systemic treatment. So it's not just giving it to the lungs. It helps clear the lungs, but there's also, you're doing a whole Ayurvedic treatment. And the herbs that are given in that herbalized steam oil is very specific. So that's what Maureen has, and that's what we have here at Sanjevani, specialized treatments that are quite unique. So let's get into the foods, because this is really important before we run out of time. Foods is the second most common type of allergy. So everybody knows that the inhalants, what we breathe, environmental, is from your lungs up, right? Eyes, ears, nose, throat, chest. But everything else that's systemic, even your postnasal drip that you're having in the winter time, if it's snowing, for example, and you're having a drippy nose, that's usually caused from foods. And the foods that you have can trigger two types of reactions. And we like to not do the skin prick again. There's a lot of false positive, false negatives for foods. And also, they only check a small amount of foods. What we like to look at foods is a blood test. And we check for two types of reactions. One is called an IgE. That's an immediate reaction. And the second is called an IgG4, which is a delayed reaction. Now, the IgE reaction happens within 1 hour of consuming the food. So you can eat something, have some gas, some bloating, some diarrhea, some constipation, some reflux, heartburn, headache, back pain, any kind of itis. Remember, inflammation, systemic inflammation is exacerbated. The second type of reaction is an IgG4. It's a delayed response that happens a few hours up to 4 days later.
Right. So it's really hard to determine what it is that's causing your allergy.
Yeah. So you can have something last Friday and today be having symptoms. Had something on Saturday or Sunday, have something on Easter Sunday, a big meal, and today have symptoms. Okay. And that's not just
that's why it's so important to do the testing so that you know specifically what it is that's causing the problem.
Right. A lot of people do these avoidance diets. There's all these trends of diet books of like, I'll forget gluten or lectins and all these bogus things out there. What we like to look at is what does your immune system have a problem with? We know that if you eat an anti-inflammatory diet, your body will be the strongest, right? If you take certain things like glucan 300, which is for your immune system, right? It will help keep your immune system stronger. Vitamin D. Go to purebetaglucan.com to learn more. There's a fourth comparative study that is now out, comparing it to now about 50, 60 different products on the market. So keeping your immune system strong is great. Keeping your inflammation down is great using like bosmeric-sr, right? So we've talked about these in different episodes, but this is how we lower inflammation. This is how we lower the allergic response from bosmeric and from glucan 300. Go to purebetaglucan.com for more. But what you want to do is you want to look at the testing, because a lot of people test and these testing companies mix the reactions. So a lot of people come in and they'll say, oh, here's my allergy test, and it's a mix. What you want to do is you want to have an IgE and an IgG4 split. Now, a lot of people have them mixed just because physicians can only order the mixed ones and non-physicians order the ones that are not. And there's a difference because you want to clarify what is more life-threatening, what can be anaphylactic, what is the severity of that inflammatory insult versus something that could be moderate to mild and something also that you can reintroduce. So the IgG4s, the delayeds, are not permanent. There's something that you can, right now the body has a problem, you can avoid it and then you can bring it back in. The IgEs, however, are stuck and they're pretty tough. So you want to eat less of the IgEs, and we can desensitize people. So not just avoidance, you can actually do the allergy drops therapy, allergydropstherapy.com, or you can, sublingual immunotherapy as they call it. So those are two different ways that you can improve that response. And more importantly, after we come back from this break, what we're going to talk about is now that we understand food allergies, right? They cause, eyes, ears, nose, throat, chest. So in spring now, why it's worse, because things are blooming, you're getting all the environmental, and you've been eating things year-wide. So boom, you get, double whammy, or we call it the twofold punch of allergy and inflammation. But we're going to talk about now, how do we heal once we get this testing? How do we actually heal the microbiome a little bit? So how do we improve it? So when you do get the foods, aside of avoidance, what else can you do to keep your body stronger? So we'll be back after this short messages, and we'll continue on with how to improve your food allergies.
Clear.
All right, everybody on Facebook Live, thank you for joining us today. My name is Dr. Pine.
Maureen Sutton.
And we are talking about allergies. And we were just talking about food allergies and food allergy testing. As many people know, if you've read my book, An Inflammation Nation, you can see that we talk about it in detail about how to test, what to look for, and how you can have an integrative doctor like myself or someone who is trained similarly help you with your allergies rather than doing this random guessing. We want to get more sensitive and specific results to guide you on what to eat and what not to eat.
And in your book, you talk a little bit about your story where you had allergies as a child. And, I know that I had some allergies too, which were really surprising to me. I turned up to be allergic to mushrooms and I had no idea. I used to make mushroom stews. I adore mushrooms. I found out that I was allergic to it.
Right.
So
And the problem is, mushrooms we love because they're one of the best sources, not only protein, fiber, antioxidants, phytonutrients, but glucan, right? But beta
right.
glucans come from mushrooms. And so now that we're lucky because when we moved to the glucan 300, was grown off a yeast culture, the patented form of the highest potency of the beta glucan available. Now Maureen can keep our immune system strong without having the problems with the allergy. Right? Remember,
Which
you
is
can be allergic
actually
to
pulling the immune system down.
right. So you can be allergic to anything, and that's why it's key to test, because even with supplements, you can have an allergy, and we'll talk about that in the next segment, and then we'll talk about what we can do to fix the microbiome. Any questions coming in yet?
Yeah, I'm sure that people will be interested in gluten and gliadin and
Yes.
celiac
Remind me
because
about that.
that's on the rise.
Okay.
And we can find those things out through the allergy.
You are tuned in to Take Back Your Health. To reach our program today, call 1-866-472-5792. That's 1-866-472-5792. Or by email to radio@sanjevani.net. That's radio@sanjevani.net. Now, let's return to Take Back Your Health.
Thank you, everybody, for listening and joining us on this last segment. We're going to continue with food allergies and understanding that in my book, In Inflammation Nation, you can go to inflammationnation.com to learn more about it. I go into detail. If those people come and do a consultation, we go into very extensive detail on looking at what are the triggers of inflammation. So testing, we look at immediate and delayed. And then the important thing we also look at is gluten and gliadin. Right, we do a specialized celiac panel, so it's not just, I avoid gluten. Yeah, we know that the glyphosate, right? We had a nice interview with Zach Bush on glyphosate and GMOs. Go back and listen to the archive if you missed that episode. Wonderful information, right? And we know that the leaky gut with the glyphosate causes the tight junctions. So that causes this rise of food allergies, which I talk about in my book. But the thing is, we want to look at is we can test for that, because if someone truly has a gluten, or more importantly, a gliadin problem, then that's more on the spectrum of getting to eventually having a celiac disease. That means that barrier is then broken over time. You have reticulin antibodies, tissue transaminase becomes positive, and then you have actually damage in the colon, right? But we want to prevent that.
It's really important to do the testing for this. A lot of people are just avoiding gluten because it's the trend. I'm gone gluten-free, and maybe there's really no big reason for them to be doing that. But if you are allergic and you do have celiac or you do have a gluten allergy, you need to know that.
Yeah, it's really important, because when they get the allergy and when they get the inflammation, it's not just a 1 hour up to 4 hour 4 days like the regular food allergies. The gluten and gliadin can cause anywhere from a 1 week up to 3 month flare. So right now, it's April, and someone could have had, on Valentine's Day, something that had gluten in it and still have their symptoms. So that's really, really important to test. The other thing that we want to test is we also look at overgrowth. We look at the microbiome. We want to look at the small intestinal bowel overgrowth issues of overgrowth of bacteria, candidas, parasites, other type of organisms that cause this imbalance in the gut, leaky gut. Because once there's that leaky gut and that sensitivity, then there's more food allergy. So we have to look at then not only what we want to look at if there's overgrowth, but our testing will then tell us what we should use natural or by prescription that is more effective. What is it sensitive or resistant to? They actually will grow it in culture, and they will test each of the microbes that if there is an overgrowth, what will work. So we're not just randomly saying, most doctors, GI doctors, like, you have SIBO, here's a prescription. No, most natural doctors, here's a candida formula or some kind of oregano product. We like to look at the testing and say, what is it sensitive or resistant to, so that we're always moving forward. We're not knocking out just the bad stuff. Remember, everything that's an antimicrobial, both by prescription or by natural, knocks out both bad and good stuff. So we always want to be moving forward. How do we improve that, though? Then is taking certain things like Restore, right? So if you listen to Zach Bush, you can go listen to that. Restore is a great product for the glyphosate toxicity. Taking probiotics, taking the right type of probiotics. In my book, I'll explain, but we have the complete probiotic formula. I just visited our factory just recently. They upgraded their facility, world-class facility, one of the
Beautiful.
probably the best probiotic company available manufacturers for us. Potency, purity guaranteed up to 1 year after the expiration date at room temperature, acid
I,
stable, with or
I took
without food.
probiotics to India with me, and I didn't have a refrigerator to store them in, but they stayed just fine for a full month, and I was the only one who didn't get what you call deli belly because
Yeah.
I was using the probiotics.
Right. And many people, if you read my book, there's a section on how to look at probiotics, how to look at ingredients of probiotics, how to know if it's valid. Remember, 10% of probiotics on the market only have what's on the label. There's only 10% that's in there by the time you take it. Ours is 100%. So there's a difference when we give 25 billion or 100 billion of 12 species. And we have specific species coming out. We'll have a show on talking about probiotics and depression and all sorts of wonderful things about the microbiome. But key is eating an anti-inflammatory diet. Right? So if you go plant-based, number one, and if you do the testing to look at what foods may be triggering, then you're on a complete anti-inflammatory diet. So you just have to look at making your body less inflammatory. And if you eat a plant-based diet, most people say, gosh, Dr. Pine, my allergies are 80% better. I go, yeah, I know, because you're less inflamed just to begin with from the animal proteins, the high sugar, high refined foods that you're eating. But once you still have that allergy, though, we can now desensitize. Now, the last thing I want to talk about is something called SAAT. It's a new type of treatment aside of the drops, but if those people are in this area of New Mexico or they're coming through or they want to make an appointment, we have a new novel acupuncture treatment that I was trained in 2014. I attended a conference at Johns Hopkins, and there's a doctor named Dr. Solomon. He's created a treatment for 10 years that they've had a lot of data on. It's called Solomon's auricular allergy treatment. We put a tiny little needle underneath the skin, and it's less than 2 millimeters. You can barely see it. I have to use jeweler's glasses to.
A little tiny cactus needle. That's what I compare it to.
Even small. It's even
Tiny,
small.
very fine. Yeah.
And we put that in a specific part. After we do the blood testing, we put in a specific part of the ear, the right side. We can put up to 2 needles, and we can sometimes cover classes. So you have a bunch of grasses, you have a bunch of trees, you have a bunch of weeds. We can knock out many of these things within 2 or 3 sessions. And we put it underneath the skin. We put a little bit of a surgical glue and a Band-Aid, and you wear it for 3 weeks. They try to keep it dry and stuff like that. But after 3 weeks, you remove it. 90% of the people have a reduction about 90% of their symptoms. And it can go anywhere from 1 year up to 10 years of the response. So before I even do the drops therapy, if someone is local or they're coming through, we like to do the SAAT treatment, because if they respond, then you don't have to worry about taking the drops 3 times a day for, say, 3 years.
And how many allergens can you treat at a time? Can you treat inhalants and foods, or do you do one at a time? How do you do that?
So when we do the SAAT, and you can go to sanjevani.net and look up, the SAAT treatment. I'll explain a little bit more. But we actually can get 2 needles, and so we can do 2 classes. So we can do a bunch of grass, a bunch of trees, or we can do like cat and soy or corn and dust mites. So it's a combination, but it's a very, very effective treatment. And in fact, most of my patients who are now local, we've moved away from the drops and we're using more of this allergy SAAT treatment because, again, it's different than this traditional acupuncture that most people get. They go and there's an allergy point, they get a little stud in there. They go, oh, that's not very specific. This is very specific. We actually energetically test based on the blood test and some physical parameters in the office of where to put that little needle. And it's phenomenal. I mean, we can get it to young children as well, as long as they're not picking at their ears. It's a great thing because if they respond, which most people do, then again, you don't even have to take the drops. But for those people who don't live in New Mexico, the allergy drops is something that could be an option.
Yeah, I had an allergy to juniper and my eyes were watering. My nose was itching. It was really bad. And I asked Dr. Pye to please give me a treatment for the junipers. Junipers are a big allergen here in New Mexico. And that was about, I think it was 2 to 3 years ago. I can't even remember now because all my symptoms being allergic to juniper has gone away. So now I'm looking at, well, okay, what else out there in my environment is starting to bother me so I can be treated for that.
Wonderful. So everybody, this has been an important episode talking about allergies, foods, inhalants, using homeopathics, nasal sprays, oral care, sublingual immunotherapy versus allergy shots, or the SAAT treatment. And I want to end by reminding everybody that we have a wonderful program coming up. I want as many of you to join us. Right now, there's a special going on. It is Food as Medicine Retreat in Curacao, the wonderful island, the wellness island now that's been declared outside of the lower part of the Caribbean. It's going to be a program August 5th through the 11th. If you go to sanjevani.net, SANJEVANI.net, and you look at Food as Medicine. And right now there's a promo code because they're giving a special up until May 5th. They're getting $300 off of the booking. It's an all-inclusive 4-diamond resort. Okay, we're actually importing all the food organically. We're going to be going to herbal farms. We're going to be doing yoga, meditation. We're doing cooking demonstrations, teaching you how to make food as medicine, herbal spices as medicine, how to even, aphrodisiacs. We're getting into everything, how the food can really be medicine. So we won't be talking about much supplements. It's going to be talking about food, and how you can make it at home, how you can make the food as medicine. So go Food as Medicine Retreat, go to sanjevani.net. Please join us. Again, there's a show special right now, and there's a promo code on our website, you can put that in, $300 off. Again, August 5th through 11th. Mark your calendar, inquire about it. Please join us. It's an amazing, amazing place to be. We'll be posting some photos and some little videos on our website and Facebook to show you how beautiful that island is.
And you'll get a lot of one-on-one time. So you'll get to meet us and talk to us in person and ask us questions and, do a little hands-on work as well with food. And also I'm going to do some hands-on with massage, sharing massage with your partner.
Okay. Thank you, everyone, and best of health.
Clear.
Okay.
Hey, I wanted to say thank you to all the people who are joining us on Facebook Live.
Well, you can talk now. We're on Facebook Live. Thank you, everyone, for joining us. We were running a little bit over, as we always do, because we get so interested in what we're talking about. So who do you want to give a shout-out to?
Ula joins us every single week. So thank you, Ula. It's really nice to see you there as a wonderful supporter.
Hi, Ula.
And Bethany.
We love the Tinley family. So we hope you had to enjoy a happy Easter, and waffles to all of you.
Oh my gosh, I can't stop singing that song. Lee Grant, thank you for joining us.
Hi, Lee. How you doing?
Jamie Lee, thank you.
Thank you.
And then all the people that I don't see your names coming up from all over the world. We really appreciate you joining us from Australia and Africa and Ireland. And
we have people from
India.
We have Saudi Arabia. We have all the Czech Republic. We have China. So give our friends out there in Shanghai, Yasin. I hope you're listening to these shows. Yes. And everybody out there, again, we want to make sure that, if you missed, to keep your immune system strong, that's another way to look at keeping your allergy down. So sometimes when people just use the bosmeric, just believe it or not, since this lowers 97 different mechanisms of inflammation naturally, very quickly, within 20 minutes. A lot of people just take this, and they don't have to take any of these other products that we mentioned because it lowers the overall inflammatory response. Right. But what we wanted to talk to you today it wasn't to be promotional. It was to really explain there's a lot of things out there. And hopefully you can listen to this show, go back and say, hey, this is something specific for me. I might want something just for my nose or something for my eyes, or I want to try something new if I get a respiratory infection. Again, things like the Glucan 300 will be, how to keep your immune system strong, eating a plant-based diet, joining us in the wonderful island of Curacao. You'll learn so much. I guarantee you this will be a game changer life experience if you come and visit with us.
And new lifestyle practices that you can take home with you and share with your family and your friends. And I can't wait for you to join us in paradise.
And again, everything is in inflammationnation.com. So if I was going very fast, which I usually do, there's a section on each of the things I'm talking about, the testing, and explains the differences and how to do it. And once people become patients of ours, it makes so much sense when they actually get their testing. And if you don't have a physician, we can do consultations. And if not, find a physician, and hopefully they can guide you, someone that's integratively trained to help you with these kind of testing parameters.
And I do nutritional consultations, plant-based nutrition consultations, and teach you how to make food simply, easily, and how to shop and how to read labels. So,
And the And the cool thing, just we'll give a little pre-announcement, is that we're working on putting in a plant-based restaurant here at Sanjevani. We're working with an amazing chef named Miguel Batista, which we'll give him a shout out. He's a world famous plant-based chef from Mexico, ranked as number 6 of all Mexico. And we're going to be working with him and some of his partners and stuff like that, developing a wonderful plant-based restaurant here in New Mexico. So again, people can come by and have a wonderful, healthy food as medicine meal. We'll have cooking classes. And the coolest thing of all is that we're going to be kicking it up a notch, because we're going to add functional foods into the plant-based diet. So we're going to look at how to add certain things that nobody in the entire United States has done on a restaurant level.
Exciting stuff coming up. So please stay with us.
All right. So thank you, everyone, for listening, paying attention, and staying with us. Please share on Facebook to your family and friends. We want to keep growing our audience and encourage people to go back and listen to all the archives. It's really important because, again, some people like to read. A lot of people like to listen. Free on iTunes, voiceamerica.app. They can download, or they can just click on demand. We will also have all these episodes on our website. So if you'd like to watch rather than just listen, and you want to see the interviews and the products that we're showing and demonstrating in some of the visuals, then go to Sanjevani, SANJEVANI.net for more information. And again, we will see you soon next week. Thank you very much.
Happy birthday, Vital. I hope you have a wonderful day.
Again, happy birthday, Dad. Thanks for everything, and best of health.